Hello, everyone. My name is Dave Melton. I'm the board chair of ITNAmerica. On behalf of our board, council, and staff, welcome to the 4th Annual Philanthropic Collaborative. I'm told we have over 190 participants, which is fantastic from my standpoint. Today, we're honored to welcome representatives from Maine Senators Collins and King's staff. We're grateful to Senator Susan Collins for helping us secure the funding for this planning effort, and to the Federal Transit Administration and to the Centers for Disease Control and Prevention for their invaluable help and support. The purpose of this event is to introduce the work of America's Volunteer Driver Center and planning for a national public information campaign to change the way Americans think about and support community mobility for older adults and people with mobility challenges. Our theme this year is Mobility Means. First group of panelists will speak about what mobility means from their perspective in philanthropy, I always have trouble with that word, and policy. The second panel convenes representatives from the transit frontier, a writer, a volunteer driver, and a transportation provider who will speak about what mobility means in their lives. Please submit a question anytime by clicking the Q&A button at the bottom of your screen. We'll answer as many of your questions as possible at the end of the event during the discussion. And now here's co-host Steve Ewell, Executive Director of the CTA Foundation. Steve?
Great, thanks, Dave. I am thrilled to be here and be part of this event. It's amazing to see how many people are involved. We were thinking back to when these programs first started, and we were down in a conference room at the CTA headquarters with just a few of us, and it's really exciting to see how many more people are engaged in this conversation. You know, we at the Consumer Technology Association Foundation recognize the importance of transportation for the older adults and people with disabilities we serve. We've been supporting ITN for the last 3 years, and we've really seen how they've been able to leverage our support to grow it into much bigger programs and much bigger effect. So we've been incredibly thrilled with the work that the ITN team has been doing. This year, we approved a grant towards the text messaging technology that's going to be used as part of America's Volunteer Driver Center. So really thrilled to have some conversation around those issues here today. We have a great lineup, and I'm looking forward to this discussion, and we'll turn it over to Katherine.
Thank you, Steve. I'm going to just try to introduce the general subject here for everyone. I'm Katherine Freund, the President and Executive Director of ITNAmerica, and I want to begin by thanking everybody for joining us here today for this event. This is, as Dave said, the most well-attended philanthropic collaborative ever, so that is exciting all by itself. I'd like to share a few numbers with you first about the transportation challenge that we're all facing, and I'll try to be fast because I'm pretty sure you are all familiar with the size of this transportation problem. So for starters, 1 in 5 Americans will be over 65 by 2030. That's every baby boomer will have hit 65 by 2030. They'll be between the ages of 65 and 85. That's about 70 million people. Older adults who stop driving outlive their decision by about 10 years. And 3 out of 4 older adults in the United States live in rural or suburban communities that lack the density for traditional transit solutions. Finally, and you may not be familiar with this number, it's from the American Public Transit Association, about 45% of the US population has no access to public transportation. So that's one set of numbers. Here's a little more information about the cost of transportation. It is extremely expensive. It accounts for about 17% of average household expenditures, and most of that money is spent on automobiles, and it does not even include the most expensive part of transit, which is labor, because people, of course, drive themselves and they don't count that as labor. Our government is currently helping older adults through Social Security and Medicare. So thinking about adding the cost of transportation to these programs will create a pretty unrealistic tax burden. And finally, rideshare services like Uber and Lyft deliver about 70% of their rides in only 9 high-density American cities, and only about 4% of their rides are for people age 65 or older. So I may be a dreamer, I don't think so. I see challenges as opportunities, and I think a lot of other people in this country feel the same way, because they are starting and running volunteer transportation programs all over the country. In ITNAmerica's National Transportation Database, Rides Insight, there are almost 1,000 volunteer transportation services. And I believe the real number is about 3 times that amount, because we can only include those that actually have websites. And there are many, many that are too small for that. Research shows that older adults absolutely love this kind of transportation. It is personal. It is local. Riders sit in the front seat next to their drivers, and they exchange recipes and pictures of their grandchildren and stories. They know their drivers. They're often friends with their drivers. It's very personal transportation, and it is beloved by people who use it. What does transportation mean then? And that's the theme of this event, what transportation means. What does it mean both to the volunteers, most of whom are older adults themselves, and to the riders? It means access to healthcare. It prevents social isolation. It helps to avoid unnecessary injuries. It helps people remain independently in their communities where they've raised their families, where they know their neighbors, and where they value their friendships. It is affordable, and it connects people to their local communities. It's really good transportation. So here's the challenge. There's not enough of it. There's not nearly enough of it. Public transportation can take care of some needs, and in high density areas, services like Uber and Lyft and taxis can also take care of some needs. But most older adults, the vast majority, depend on volunteer transportation services. And in many cases, it is the only transportation service available to them. So it's going to have a very large and increasing role in mobility for America's aging population. It's inevitable. It's inevitable. So I've been going to Washington and meeting with Senator Collins' staff every year for about 20 years. And finally, just before the pandemic, I met with Senator Collins' staff person, now retired, Mark LeDuc, and I said, we're not solving the problem fast enough. We need to do something from the top down, the way the Americans with Disabilities Act did something from the top down. And the example I gave him was the Red Cross. The history of the Red Cross is really interesting. In 1941, it was the United States government through the U.S. Armed Services that asked the Red Cross to set up a volunteer blood donation program. Today, the Red Cross supplies 40% of the nation's blood supply. So transportation for our aging population is just such a national need, but for senior transportation, for transportation for people with mobility challenges, there's no national program. Every community is struggling on its own to meet the challenge, and the people who are running the volunteer services are overwhelmed by demand. There's not nearly enough supply, and as a result, really good people with the very best of intentions set up volunteer systems that fold unnecessarily because they just become overwhelmed. It's too much. There's too much need, even though they're providing a wonderful service and even though everybody loves their service. So I, in meeting with the senator's staff, said we need to do something. Mark said, what do you think we need to do? And I immediately knew I said we need more volunteers. We need to do for volunteer transportation what the Red Cross did for blood donation. And Mark said, find me a federal agency that'll work with you, and I will ask the senator to support you. And I went to the people I've been working with at the CDC since the early 1990s, and I asked them if they would work with us on a public information campaign to recruit volunteer drivers. CDC is an expert in public information campaigns for health. And they said, if you can align with our strategic goals, then we can work with you. And the goals they wanted us to align with were injury control and access to health care. And I said, done, done. When congressionally directed spending came back, the senator's staff contacted us and asked us if there was something we were interested in. I immediately said, we need a national volunteer recruitment program for transportation for older adults and people with special mobility needs. And Senator Collins secured the funding for us, and America's Volunteer Driver Center was born. The estimated cost for this national public information campaign is $20 million, and I believe that is enough to change the way Americans think about and support mobility for our aging population. So here's the plan. There's going to be, it's about a 2-year planning effort. We have started. There's going to be an environmental scan, which is a look at everything that's out there. And we've done a very detailed 15-page literature review already. There's going to be a technology plan, extremely important. There needs to be one place that people know they can go to if they want to volunteer to drive. Like, if you think about it, if you're going to donate blood, you go to the Red Cross, right? Everybody knows that. It's automatic. You know, not one of 3,000 different organizations that are out there with all different messages. And there needs to be one place where transportation providers can go if they need volunteer drivers, just like hospitals can go to the Red Cross for blood supply. So an environmental scan, a technology plan, we're going to do a marketing plan, which is going to think through what are the messages we need to send, who are the audiences we need to reach, and what are the channels we need to use to reach them. So reach them with the marketing plan. They come to the internet, to the place that we have built with the technology plan, and they find out what they need to know and whether or not they want to volunteer to drive. And there we match them with any nonprofit organization in their community that needs volunteers. So it's pretty simple. We're also going to do a financial sustainability plan. And because once we figure this out, we want it to have a life so that it can help everybody. We've also created an advisory council, which is comprised of people and organizations in the field, and you'll be hearing from some of them later today. On the second panel, we've created a leadership roundtable, very, very important body that's going to have representation from government at all levels, federal, state, county, local, and tribal. It's going to have representation from the world of philanthropy, and it's going to have representation from the business world and the world of industry. And it's going to conclude with a plan and funding and a report to the Secretary of Transportation. Many of our speakers here today are from the Advisory Council and from the Leadership Roundtable, and they're going to speak about what mobility means to them and what mobility means to the older adults that they serve. I believe this transportation challenge is a fabulous opportunity to change the way Americans think about and support mobility for our aging population and for the many people with mobility challenges. I believe it's a wonderful way for the country to come together to do something for our families and our communities. I believe that if people will lie down and give their blood away, that they will give someone's mother a ride to the supermarket. We just need to ask them. I believe we can do this. So that's me. I know I get very gung-ho, but I absolutely believe in what we are doing. I would like to now introduce our wonderful keynote speaker, Stacey Easterling. It is my privilege to introduce her. I met Stacey when she was a program officer for the Atlantic Philanthropies. She has had an impressive career in philanthropy. She's worked for the Virginia Piper Charitable Trust out in Arizona. She's worked for the Missouri Foundation for Health and the Cleveland Foundation. She had a long career at Planned Parenthood. Today, Stacey is the new executive director for the new National Institute for African American Health, which is, I think, a platinum example of an idea whose time has come. Please join me in welcoming Stacey.
Thank you so much, Katherine. What a wonderful welcome. So nice to connect with you again and to be in the space with ITNAmerica. Good afternoon, everybody. I'm actually in Phoenix, sweltering, and it's morning, and it's already 102. But I'm going to stay cool right here talking to you, and so good to be in this space. I'm here to discuss a critical issue that affects the health and well-being of individuals and communities across our country. And it's the social determinants of health, and I want to talk about the vital role that transportation plays in accessing healthcare. So in my remarks, I want to introduce you to the mission and the work of the National Institute for African American Health. Like she said, it's new. I want to talk a little bit about that. I'm going to highlight also the commendable efforts of ITNAmerica and America's Volunteer Driver Center. I want to also highlight the importance of volunteerism and explore how these initiatives can address and improve health outcomes while reducing disparities, which is really something that's important to me and the work we do at NIA. So finally, I also want to talk about responsibility. Who's responsible for supporting this type of work? And here's a spoiler alert, sort of rushing to the end. The answer is all of us. So let me start with our first slide, my commercial about NIA. The National Institute for African American Health, and we call it NIA for short, is an organization focused on improving the health of African Americans. NIA was based on a few basic assumptions and guiding principles that that really underpin its importance and its mission, and I just want to share those with you first. First, health disparities exist, particularly when comparing the health outcomes of African Americans to those of white and other populations. These disparities are concerning and require focused attention to bridge the gap and ensure equitable health outcomes for all. Second, we believe information is power. African Americans need to be empowered with reliable and trustworthy information to take care of their own health. Access to accurate health information plays a vital role in enabling individuals to make informed decisions and actively participate in managing their own well-being. Our third is race matters. The presence of a physician who shares a similar racial or ethnic background with the patient has been shown to have a significant impact on the patient's level of engagement in their healthcare journey. This connection often enhances trust, it facilitates communication, and it fosters a stronger patient-provider relationship, which ultimately leads to improved health outcomes. Fourth and finally, we believe that cultural competence makes a difference. So culturally competent care provided by physicians is crucial in providing better health outcomes. Healthcare providers who possess a deep understanding of diverse cultural backgrounds can deliver care that's sensitive to the unique needs and values of their patients. So this approach fosters mutual respect, it enhances patient satisfaction, and we hope contributes to improved health outcomes. So these are some of our basic assumptions, but there are lots of other guiding principles that we walk into it. But with these in mind, NIA tends to do our work in several ways. Can you change the slide, Nick? First and foremost, we recognize the importance of increasing the number of Black physicians in our country. Extensive research has shown that mentorship plays a vital role in the success of medical students. So our NIA Scholars Program connects African-American physicians with pre-med and medical students, supporting them through their journey from admission into medical school to graduation. We want to get them into medical school and then get them out. This mentorship program aims to boost the representation of Black physicians and improve healthcare diversity. In addition, we've developed a unique platform called Our Health, which will serve as a reliable and trusted source of health information specifically tailored for African Americans. We use the phrase FUBU, which is F-U-B-U, for us, by us, as our guiding principle. Our website offers free access to a wealth of educational resources. These resources include articles authored by our own medical experts, as well as links to other relevant resources. Our goal is to provide comprehensive health information that caters to the specific needs and experiences of the African American community. Further, our NIA Certified program focuses on ensuring culturally competent care for African American patients. We offer education and training to physicians to enhance their understanding of the unique cultural aspects involved in providing effective care to African Americans. Additionally, we support patients in advocating for themselves when they encounter substandard care. By empowering patients and healthcare providers alike, we strive to address the disparities in healthcare that are happening right now. As Katherine said, I joined NIA earlier this year, and I'm extremely passionate about its goal and its vision for the future. As a grant maker, which I've been doing for over the past two decades, I've worked in both the health and the aging space, supporting organizations that strive to improve health and well-being, especially to those most vulnerable and marginalized in society. As I reflect on my journey, the sad conclusion is that over the past 20 years, there hasn't been a lot of change. Disparities between African American health outcomes and those of others are worsening, and the gaps are widening. But I see a window of opportunity in our sites, and I believe that NIA can serve as an agent of change, mostly as a hub connector and a collaborator. We look forward to partnering with any organizations with a common goal of health equity for Black people. So now I'm going to move into the issue of social determinants of health, which is probably not an unfamiliar topic with most of you, but I do want to go over a few things. We know that health is not solely determined by genetics or individual choices, but is heavily influenced by the conditions in which people are born, they grow, they live, they work, and they age. I heard a phrase just the other day, which I thought was really striking. It said, your zip code is more influential in how your health outcomes are than your genetic code. And I think that speaks to what we know about the social determinants of health. So these social determinants of health, including factors like income, education, housing, and transportation, significantly impact one's ability to access healthcare and ultimately affect health outcomes in the end. Access to quality healthcare is a fundamental human right, and it's crucial to ensure that everyone, regardless of their background, has an equal opportunity to receive the care they need. One of the key social determinants of health that goes unnoticed often is transportation. So imagine where you have a scenario where an individual is in urgent need of medical attention, but they lack the means to reach the nearest healthcare facility. We all know that scenario way too often. And this unfortunate reality is faced by so many people, particularly those residing in underserved communities, both urban and rural ones. The lack of transportation options can be a significant barrier for preventing individuals from accessing necessary medical care. This leading to delayed diagnosis, untreated conditions, and poor health outcomes. As a funder in health and aging, I understand the connection between transportation and health, especially for older adults. Mobility, like Katherine says, means everything in people's lives. Right now, we're talking about health, and I'm focusing on that in my remarks, but we all know that it's critical in many aspects of our lives. And we don't think very much about, what we don't think about very much is what happens when we are no longer mobile. And when I say mobile, I mean specifically being able to move freely to do and get everything that we need. We know that COVID-19 gave us a little taste of that, what that limitation is like, what that isolation is like. And none of us want to go back to that position again. Through COVID and through time, we've received a wake-up call, and now it's time to act. Fortunately, there are organizations like ITNAmerica that have been moving into action and play a vital role in addressing the challenges we face. As a former funder, I had the privilege of witnessing ITN in action when my foundation, the Atlantic Philanthropies, provided support to Katherine and ITN. I commend them for their unwavering commitment over the past 20 years to tackle this issue head on, and she's been a champion. I want to say bravo to you all for doing that. America's Volunteer Driver Center actively works towards bridging the transportation gap. By mobilizing a network of compassionate volunteers, ITNAmerica ensures safe and reliable transportation for individuals who would otherwise struggle to access healthcare facilities. Volunteerism lies at the heart of these endeavors, and its significance can't be overstated. Through the selfless dedication of volunteers, ITNAmerica is able to make a tangible difference in the lives of those in need. By generously giving time, energy, and compassion, volunteers become the driving force behind a more inclusive healthcare system where no one is left behind due to transportation challenges. It's also important to acknowledge the benefits of volunteering extend beyond the recipients of assistance. We know that studies have consistently shown that volunteering positively impacts the health of individuals, particularly older adults. By supporting a robust volunteer infrastructure, we not only enhance the well-being of those in need, but we also contribute to the overall health of communities. ITNAmerica's initiative not only addresses transportation barriers, but it also highlights the transformative power of volunteerism. By fostering, again, a strong volunteer network, we can collectively work towards better health outcomes, the elimination of disparities, and the empowerment of individuals to create their own solutions. This multifaceted approach is a win in so many ways, benefiting both those who receive assistance and the volunteers themselves. So this is all fine and well, but who's responsible? Kind of going back to my original premise, who should be held accountable for addressing this issue? Unfortunately, funders and grant makers often look at transportation efforts. They consider it the sole response. They overlook it because they consider it to be the sole responsibility of government. I can't tell you how many times I heard that from board members over the years and work in multiple foundations that I worked at. I wasn't alone because as I talked to my peers, they too indicated that they would steer away from recommending such support. Yes, government support is essential. It's critical. But it's equally important for philanthropy and grant makers, both private and corporate funders, to recognize first the significance of transportation and healthcare access. By recognizing that impact of transportation on health outcomes, they contribute to a more holistic approach in addressing social determinants of health. Second, providing grant support is critical. By supporting transportation initiatives, funders can complement government efforts and contribute to comprehensive solutions that address the social determinants of health that we talk about. We need to step it up. This is our call to action. We need to start now. As I wrap up, I want to leave you with this message. The social determinants of health significantly impact health outcomes, and transportation plays a pivotal role in ensuring equitable access to healthcare services. NIA will work tirelessly to eliminate health disparities. And programs like America's Volunteers Driver Center showcase the power of volunteerism in overcoming transportation barriers. As a nation, it's our collective responsibility to address these issues. And by addressing volunteer-driven solutions and fostering collaboration with support from both philanthropy and government, we can make substantial progress towards improved health outcomes and reduce disparities. Excuse me. I want to thank you for your attention. I just wanted to share some remarks with you and ask that we remember that together we have the power to create a healthier and more equitable future for all. I look forward to any questions you might have or any comments, and I definitely look forward to you exploring more about NIA, and congratulations to ITN for all the work that they do. I'll pass it back to you, Katherine.
Thank you. Did you want to take a question?
If we have time, I'm glad to take any questions that people have.
Susan is fielding questions for us. Did anything come in for Stacey? We can also take questions for you at the end, Stacey. Well, here's one.
Like to.
Yes, how can transportation providers be most helpful in ensuring transportation for African Americans to reduce inequities and health outcomes in our community? How can, oops, that question just went away. How can transportation providers learn more about NIA?
Definitely, I would love to have anyone and everyone go to the NIA website. That's the start. We have some information. We're trying to build a robust space for lots of information for lots of different sources. So I say, one, go to our website, and also checking out our social media, where we will continue to share ongoing health information. And we're trying to build partnerships to share who can work on what issue as the issues come up that are relevant to African American health. So I say start with the website and reach out to me whenever you can. And I'll my email, just so you know, is Stacey@nia.org, and Katherine will have our information.
Yeah, anybody who wants to reach out to Stacey through us, we'll forward everything to you, Stacey.
Thanks.
Okay, thank you so much.
There are no other questions then.
Patricia is introducing our next speaker.
Hello. Thank you very much for allowing me to introduce this amazing panel. We're going to begin our panel of leaders from philanthropy, government, and policy. Our first panelist is Lindsay Goldman, who is the CEO of Grantmakers in Aging, a membership association for funders mobilizing financial, social, and intellectual capital to improve the experience of aging. She also has extensive experience working with cities to engage residents and volunteers. Lindsay, let's get started.
Thank you so much, Patricia, and thank you for including me in this esteemed panel. I am going to attempt to share my screen. And let's see. Is everyone seeing the man in the hat?
Yes.
Yes. Okay. Okay. Now I am not seeing the man in the hat. Okay, I see him now. All right. So thank you so much. As Patricia said, I'm Lindsay Goldman. I'm the CEO of Grantmakers in Aging. We are a network of funders working to mobilize financial, social, and intellectual capital to improve the experience of aging, not just now, but in the future. And we are proud to count the CTA Foundation and the New York State Office for the Aging, as well as the Piper Charitable Trust, as longstanding members. GIA creates opportunities for funders to connect, collaborate, and to co-fund. We help funders who are already investing in aging to do their funding more strategically. And we help funders who are not funding in aging to either see the light, or more likely to identify the intersections between aging and literally every other funding priority. We serve as a convener, as a thought partner, occasionally as a grant maker, and as a champion for all things aging. Our vision is of a just and inclusive world where all people are fully valued, recognized, and engaged at all ages. We believe that diversity, equity, and inclusion are core philanthropic values, and we believe that aging is a core component of diversity, equity, and inclusion. While our objective is to attract more funders and more dollars to the aging space, our end goal is age integration. Because a society that engages, connects, and cares for people at every age is a healthier, more creative, more productive, definitely more interesting and more fun society. But also because we're all aging all the time, and we're aging at the intersection of multiple identities. We're aging in relation to other people, as caregivers and as care recipients, as drivers and as passengers, and sometimes it just depends on the day or even on the hour, how people identify. Our ideal state is not to age in place, but to age in community. And that means that we're aging while moving between environments. But as we age, the moving piece becomes more complicated, which is what we're here to talk about today. Mobility is essential for social, physical, economic, and political participation. All of the things that make for a healthy and meaningful life. And I know this because I've recently had surgery and I have been unable to drive for the last 2 weeks. And I live in the suburbs. All day long, that Iggy Pop song, I Am the Passenger, plays in my head. If you don't know it, please look it up, though I recommend the Susie and the Banshees version. Anyway, for me, and for the philanthropic sector, volunteer driver programs can help to achieve multiple goals. First, they provide opportunities for older people to serve their communities and for people of different ages to connect, which we know helps to reduce ageism. Second, and Stacey mentioned this better than I will, but they address multiple determinants of health. Yes, transportation, but also access to health promoting resources, to nutritious food, to social and spiritual connections. The Surgeon General recently issued a new national framework on social connectivity, and many of the interventions cited are fueled by philanthropy and require transportation. Third, these programs are place-based, and the vast majority of GIA funders are local or regional. Fourth, the programs can be implemented in any geography, including rural communities. And finally, volunteer driver programs are well suited to public-private partnerships that leverage multiple funding streams. We do need an all-hands-on-deck approach. So I want to talk about an opportunity. Given the dearth of funding in the aging space, it is critical for government and philanthropy to align to maximize resources. And that's why we're seeing significant momentum around state multi-sector plans for aging. State multi-sector plans, sometimes known as master plans, but we are attempting to cancel the word master, serve as blueprints for action on aging across sectors. They can help to pilot, spread, and scale effective practices. And many GIA members are fueling MPAs as a way to codify past age-friendly community successes, including those in the area of transportation, and then expand on them by engaging more partners, breaking down administrative and operational silos, drawing upon a wider array of funding sources, and then tracking the impact of a coordinated effort to improve well-being in later life. More than half of states are currently initiating or implementing MPAs, which you can learn more about at the website on the slide. funders are also experimenting with scaling multi-sector plans down to the county and municipal level. This is a huge opportunity for ITN and for volunteer driver programs, because every multi-sector plan for aging should address the mobility needs of the aging population across all abilities and geographies. Finally, several years ago, GIA did a lot of work on volunteer driver programs. So I've included some of our resources on the topic, all of which mention ITN and the value that we all receive from the work that they do. And you can access all of these on our website. So thank you so much for listening, and I'd be happy to answer any questions now or later.
Thank you, Lindsay. That was inspirational. We really appreciate your time and sharing your expertise with us. Our second panelist is going to be John Cochran. He's the Chief of Staff from New York State Office on Aging. John has 31 years of experience working on aging issues at the statewide level. Welcome, John. You're on.
Thank you, Patricia. Thank you so much for the opportunity to be here with you all. Lindsay, your comments were spot on, and I so greatly appreciate your in-depth perspective and how you view all this. And it's always great to have you as a partner as we engage in our processes here. And Katherine, Freund, and Nicholas, it was such a delight to talk with you guys yesterday in preparation for today. I so enjoyed it. It was such a great, thoughtful, it was so thoughtful, and just basically provided me with a much greater appreciation for your work and the things that you're doing. And so what I wanted to talk about, and you know, building off of the reflections that Lindsay shared about the experiences of growing old and aging, is that, you know, we all know that no one ever has the same experience. Everybody has a different experience as they grow older. But one of the things that is becoming crystal clear is that the notion of transportation is something that's universal. It becomes a universal challenge that we all face. And it's something that has become more and more important as we think about the ramifications of the realities of how our communities were designed, the efforts that were taken to provide for individuals during the baby boom generation, people coming back from World War II, the Korea. We built these huge suburban communities, suburban sprawl, that has generated a whole new series of challenges that at the point when these things were evolving and established, we never thought through the ramifications of what is this going to do to people as they age? Will they be successful? And as the trials and tribulations of the American lifestyle continue to play out, and our understanding about the realities of changing demographics and changing lifestyle, that we have a problem on our hands. And, you know, I'm so grateful, Katherine, for your commitment, for the commitment of all you that are on this call to hear the call to action as you develop your understanding of exactly what this project is all about and how it interfaces with the larger conversations that are occurring. And New York State is one of those who is engaged in a dialogue about developing a master plan on aging. I'm up to my eyeballs in it each and every day. And transportation is one of those key issues that is getting tossed around. So in New York, one of the things that we clearly understand is that as part of our network, aging services network, that transportation is a key element of it. And as part of our homage to understanding and appreciation for the development by the World Health Organization of the 8 domains of age-friendly transportation is certainly one of those key domains, and will be one of the key pillars within our master plan on aging in terms of making sure that the plan is successful and actually is scalable and implementable. Currently, the Aging Network Service system is providing transportation services to approximately about 30,000 people. Now, we know there are over 4.1 million older adults in the state. We need to be doing better. We need to be able to serve more people. And we're looking for innovations, and partners like ITN is something that Greg Olson, who's the director of the State Office for Aging, has been talking to Katherine, and he and I, when we were talking yesterday, he asked me first off to send his regards, Katherine, to you and to the entire team at ITN, because he so greatly appreciates the work that you're doing. Because the work that is ongoing in New York, we hopefully will provide us the ability to better understand and how we can implement that American Volunteer Driving Center, the systems that you've developed, and how we can implement those here at the state level. We're providing, again, to that 30,000 individuals, doing about 1.1 million rides are provided each year, with a total expenditure of about $21 million from all sources, federal, state, local, as well as through contributions of individuals. This work is so important because in New York, a lot of people always tend to think New York City when they think about New York. Well, you know, public transit is only available in about 5% of the state, leaving rural and suburban communities with little or no options. And we all know that, you know, public transportation also assumes a whole host of issues that people, one, know how to use it, two, to physically be able to use it, and then to afford it. We know we need other options and models. We know we need a robust volunteer model, and that's why we're so excited to hear about the work of ITN. And, you know, it'd be fantastic if we could think through about how we could possibly replicate some of the work that is going with the high cap and the lit cop program in New York, where we're providing small stipends to help enhance volunteer enrollment efforts. In New York, we have partnership with GoGo Grandparent to test this specialized ride sharing program in 3 counties, Erie, Monroe, and Suffolk. And we're looking to analyze and hopefully will lead to expansion of that model. And again, it's another key part of our dialogue as we're building out the MPA, and we're, you know, so looking forward to making sure that we stay in contact with experts such as yourselves on this webinar, as we continue to think through about how we can further implement these types of models and push them out into suburban areas that we know so many people might be able to benefit greatly from the work that you are all doing. So I look forward to the continued conversation, and look forward to any questions that you might have when it is appropriate. Thank you.
Thank you very much, John. And I would encourage anybody who has any questions, either for Lindsay or for John or for any of our presenters, to please pop those into the chat, and we will be monitoring those questions. Next, I'm going to introduce Lori Parham, AARP State Advocacy and Policy Director. Lori has more than 18 years of public policy and advocacy experience on behalf of older Americans. Lori has been a faithful advocate for increasing transportation options and truly is a national expert on this topic. Lori, over to you.
Thanks, Patricia, and hi, everyone. It's great to be with you this afternoon and talk about this important issue from AARP's perspective. It's going to be very difficult to stick to 5 minutes. For those of you who may not know, AARP is a nonpartisan nonprofit organization, and we advocate for the more than 100 million Americans age 50 and older and their families. We do this at the federal level, but we also do this at the state and municipal level as well through our 53 state offices, where the rubber really hits the road. At AARP, we believe all people need access to a variety of travel options, regardless of characteristics such as age, ability level, income, race, and ethnicity. And we approach this work, we have several principles that frame our broad goals for policymakers at all levels of government, and also community stakeholders who are working on these important issues. And these principles are framed around our goals to provide a variety of transportation options to meet the needs of all Americans. These include promoting affordable transportation options, ensuring that the transportation is accessible for all, promoting healthy communities through a sustainable transportation infrastructure. And I'm so glad the connection between health and transportation has been a key part of today's conversation, because it's so critical, especially as someone who lives currently in a rural state. I see this firsthand. a very rural state, fostering coordinated transportation services and assets, and also working to strengthen federal leadership and transportation. I think we all have a story we could tell, whether what Lindsay noted about not being able to drive for a while, or the loved ones that we care for, where transportation has become an issue. And for me, this was with my grandparents, who I helped to care for in rural Louisiana, who were very not near easily walkable services. And as they grew older, had conditions that made it even difficult to walk. And the conversation around giving up the keys with my grandfather was one of the most difficult conversations we had to have. And I'll never forget when we caught him driving up to the corner store, and his response was, "I wasn't driving, I just went up to get some eggs to make breakfast." So I think for so many of us, the stories are truly personal as we look at ways to really address the issues that Katherine noted at the beginning of the conversation. And I would, if I didn't note, that I've had the pleasure of working with Katherine in lots of different communities from Florida to Maine, and the importance of the work of ITN and ensuring that anyone like my grandfather can safely get to pick up those eggs. So from a policy and programmatic perspective, we advocate on behalf of older Americans at AARP at each point along the driving continuum. Everything from offering our smart driver course to help keep you safe on the road, to ensuring stronger consumer protections as it relates to insurance for both older drivers and those who volunteer to drive them. We support CarFit, where trained experts will show you how to enhance your comfort, safety, and fit within your vehicle or within your loved one's vehicle. We work to ensure older drivers aren't judged by their age alone. Older adults are more likely to have safer driving behaviors than other age groups. We work to ensure transportation alternatives are in place when older Americans can no longer drive or choose not to drive, as many do, including volunteer transportation programs. And we advocate for needed funding as the needs for these programs and supports grow across the country. So according to surveys conducted by AARP, roughly 90% of seniors want to age in their community. And to do that, access to transportation is essential. Yet more than 8 million Americans age 65 and older do not drive, and that number is increasing by the minute. Our most recent Home and Community Preferences National Survey reinforced that automobiles are the most preferred method of transportation among 50+ adults in the United States. 9 in 10 older adults drive themselves, and about a quarter have others drive them to conduct their daily activities in their community. All of these folks are making plans to stay in their community, whether they're driving themselves or currently relying on others. And they want the features that will allow them to age in place. They overwhelmingly do not want to move out of the communities where they live or move into long-term care type facilities. I've got a great one-pager on the transportation piece I'll put in the chat when we're done. Our policy, we have strong policy to support transportation efforts at all levels of government. For example, we note that state and local governments should encourage ride-sharing, volunteer programs, and other low-cost programs to help meet older adults' transportation needs. And this should include public-private partnerships. We also note that Congress should increase the charitable non-taxable reimbursement rate for charitable driving to equal that for business-related driving. This would encourage individuals to participate in volunteer programs. I must admit, I'm personally stunned that the 23 mileage rate is 65.5 cents per mile for business purposes and 22 cents per mile for medical and 22 cents per mile for medical and moving, but only 14 cents per mile for charitable purposes. I want to quickly share some of the ways we've engaged in advocacy this year. We have dedicated staff in government affairs supporting this work in Washington and in partnership with our colleagues in our Public Policy Institute and our staff and volunteers working across the country. At the federal level, we've weighed in on transportation funding through the appropriations process. We noted that transportation is essential to enable older adults to live independently in their homes and to stay connected in their community. We've urged the subcommittees to provide $12.4 million for the Federal Transit Administration's Technical Assistance and Standards Development Program, This money is essential to enable the FTA to provide technical assistance, education, and support to increase the availability and accessibility of transportation options for older adults and people with disabilities. At the state level, we've been busy as well. These are just a couple small highlights. In Maryland, our state office worked to require the Maryland Department of Transportation and the Transit Administration to consider ways to achieve equity in transportation service to traditionally underserved communities and its major plans, operations, and goals, including the Maryland Transportation Plan for 2045. In Mississippi and New Mexico, we were successful in supporting efforts to expand Medicaid funding for transportation. In Oklahoma, we're working with state, city, community, business, and tribal leaders to make sure that discussions around transportation continue to happen and become front and center. And you can understand the importance in a place like Oklahoma. And then I want to note that more than half of the communities enrolled in AARP's network of age-friendly states and communities are also working on creating or improving age-friendly transportation programs and services. We had, I just wanted to give shout outs to a few of the states who've shared work. In Tennessee and Nashville, there's a real effort as part of their age-friendly plans to address Nashville senior ride transportation and mobility issues. In Indiana, we're collaborating with partners to ensure a strong transit act that will ensure that local communities have access to what they need to build and address public transit. And in South Dakota, we've just become a member of the Sioux Falls Mayoral appointed Active Transportation Board. So around the country, our state offices, through staff and volunteers, are looking for ways to continue to raise these issues and look at a number of ways to address the challenges. Quickly, I'm just going to put up, share my screen and put up some resources for folks, and then I will hand it. Oh, of course, now I can't. That's what happens with PowerPoint and trying to share. Okay, share screen. There we go. There. And then, okay, so just quickly, through our Public Policy Institute, you can find research and policy papers on transportation, volunteer drivers, and the future of transportation. And we can make sure these are available afterwards. I wanted to note our livability index, how livability is your community. You can go in and look at a range of issues around livability, including transportation. And then I also wanted to note our Livable Communities program site, where you can sign up for the weekly newsletter and also follow the great information through the Livable Communities program site. I should give our Livable Communities team a shout out for the work they did in just disseminating more than 300 grants, I believe, across the country to support livability efforts, including some related to transportation. And I will stop sharing my screen and turn it back over to Patricia.
Thank you very much, Lori. This was extremely helpful, and thank you especially for sharing all those resources. Again, if you have questions for Lori, go ahead and pop them in the chat. Now we're going to shift directions just a little bit, and we're going to begin our panel of speakers from the transit frontier. We've heard why this is important, why volunteer transportation is important from the national and statewide perspective. Now we're going to hear from people who are actually implementing the programs. Does it work? That's what we're going to find out. So please allow me to introduce Mike Luce, a longtime volunteer driver for ITNPortland. Mike is a retired community mental health professional who's deeply invested in the local Portland community. Mike, thank you very much for starting us off.
Oh, glad to be here. So to give you some of the perspective of the driver on the road doing it, there's so much breadth to it, and it's so varied. There certainly is a really big need for people to just get out, not just to the medical appointments, but to, to pottery class or to whatever it is they want to do to live a life. I know Stacey was talking about the, the health outcomes and such, and it's not just getting them to the appointment. It's not the destination. Sometimes it's the journey for somebody that doesn't get out much, and you get to talk to them, you get to know them, they get to know you. Relationships develop. Our motto that I just love is arm in arm and door through door, right up to whatever they need. And not more than that, you know, there's a lot to it, but you get to respond to the individual needs. It's whatever they want you to do. And it is so freeing, especially as a volunteer. I'm not worried about a paycheck or anybody or that. It's, and you get to give back. There's such synergy in that. One of my favorite stories, a little thing after COVID, when things finally opened up again, I had driven right through the shutdown and everything because people still needed to get to dialysis and such. But when things opened up again, one lady that, you know, had always gone to her hairdresser regularly, and finally the hairdressers opened up. And when I went to pick her up after that first appointment, I went in and fetched her, walked her out to the car, got her in, smelling of hairdresser stuff. And I looked over and I said, well, how was it? And I will never forget the beatific face. And it was just, her response was, best shampoo ever. It meant that much to her. And it meant that much to me too. Let me tell you, it just emanates, and you share that stuff. It doesn't get any better than that. You know, when people ask me about this, I tell them there's no better volunteer gig out there. You drive around and you talk to people. How hard is that? Lift a wheelchair once in a while, tote some groceries. And it's good for my health. It keeps me going. It gives me something to do. I look forward to it. I used to love my job, but it was tough. It was stressful. This I just love. It's wonderful. I don't think I need to say any more. People need to try it, need to experience it. It is, like I said, it's real synergy. It flows both ways.
Thank you very much, Mike. It certainly sounds, from your perspective, like this works. So we're on a roll here. Our next speaker is Sam Purington. He's the Executive Director of Watertown, New York's Volunteer Transportation Center, a nonprofit transportation service whose volunteers drove more than 5.5 million miles last year alone. That's a lot of miles. After 12 years in his current role, Sam still draws on his private sector experience as he continues to scale his rider and volunteer drive base. Sam, you're on.
Thank you for that. Oh, you're muted, not me. I saw the mute button pop up. So thanks for the opportunity. The Volunteer Transportation Center has been in existence since 1991 here in upstate New York. We're way upstate near the Canadian border, where we've had a lot of smoky days of late as the wildfire fires bring smoke to us. But over those 31 years, we were founded as a volunteer center. There was a need in our community. The United Way founded a volunteer center to connect volunteers with those that needed volunteers. But what we found out very quickly is that there was one major need in our community, and it was rides. We needed rides. So the area we serve is mostly agricultural, some industry, but it's all rural upstate New York, which really mirrors most of rural America, as I've been doing this for a while, and it really isn't a whole lot different. We use volunteer drivers using their own vehicles to transport people that are seniors, disabled, blind, poor, you name it, to get to their doctor's appointments, other medical appointments, grocery shopping, and other social determinants of health as we can. We do that with a fleet of about 300 volunteer drivers. Pre-COVID, that was about 450. COVID, obviously knocked down just some folks who just, they didn't drive for a while and then found other things to do. But those 300 volunteer drivers are extremely busy on a daily basis, performing about 800 rides. But enough about, what we do. Why do we do it? I talked a little bit about how the United Way said, you know what, we need a volunteer center. We know there's people out there willing to volunteer. But if you know that you want to give blood, you know to go to the Red Cross. If you really like to help people that are dealing with fires, you know how to get to your local fire department. If you care about pets, you pretty much know how to get to the local SPCA. It's volunteer driving that tends to not have exactly what Katherine's trying to set up here. You don't have a one-stop shop to go to. We're pretty lucky that up here we have the Volunteer Transportation Center, but we don't have that elsewhere in the US. We have small, very small ones. So it's a fantastic idea. I remember when I was working for the private sector, I was in my 20s and early 30s, and I used to hear about the Volunteer Transportation Center. And as I'd hear about it, I kind of thought to myself, well, why do people have trouble getting rides? I don't understand. It didn't resonate with me at all. Because my world was the town where I grew up. My grandmother, when she got to the point she couldn't drive anymore, had 28 kids and grandkids living within 15 minutes of her. And we all supported her and drove her to all her appointments, took her wherever she needed to go, stopped in to see her on a daily basis. She had a community, a family. And it wasn't a problem. What I've seen now since working in transportation is that is not the case. She was lucky. And kids leave, they go to work elsewhere. They have to find work, especially in rural America. And when that happens, you've got, grandparents that don't have kids and they're just stranded. They can't get out and do. And, very quickly, they're going to end up in a nursing home with a very low quality of life. And that's just not what we want to see for folks. So I kind of used to think, well, who used to take care of this? Why is this a problem now? And it wasn't a problem. Is it just bad information? I think there's some credence to the fact that the church community did a lot of this. And there was a lot of churches that took care of their own parishioners, the families of the parishioners, and they did a lot of this work. And I don't have data to support this, but it's clear, at least where I am, that the ability for churches to have as big of an impact as they used to is just not there. They don't have the size, they don't have the congregations that they used to have. So I think that's kind of been a driving force to this need becoming more and more prevalent everywhere. Other things that we see is in rural America, at least in upstate New York, and I think it kind of holds true everywhere, is that while ride sharing through Uber and Lyft works extremely well in dense urbanized areas, in rural areas, it doesn't work because the model can't work. There's not enough density there of Uber drivers, Lyft drivers, and other rideshare companies to where you can just push button, get ride. And so what can happen is if you can get one way to the trip, you might get stranded. You might not get home. So that sort of solution isn't going to work. Public transportation systems are fantastic in rural America. The problem is, like in our area, we're huge. We've got counties that are, bigger than Rhode Island, which is not that big, but we have counties that are bigger than Rhode Island, where it takes you, 3 hours to get from one end to the other. So a bus system's great, but if you've got to get, from one part of that county to the other, the wait, you could have a whole day trip just for a 1 hour doctor's visit. And what happens when you get out and the bus doesn't come for, 5-6 hours? And for employment purposes, if you have a job and you have limited transportation options, that's not going to help you either. It can help a lot of things, but it is not the end all be all. It has to be supplemented with programs like volunteer drivers. And so, those are some of the things that we're seeing about why mobility matters. Some of the stuff that Mike talked about as far as the impact that this has on volunteer drivers' life can't be undersold. We had a volunteer driver who spent his whole life teaching. Actually was a teacher of mine. He was a great guy, and got ready to retire, had a good retirement set up. Him and his wife had all these plans. And then right as they're getting ready to retire, she gets a stage 4 cancer prognosis. And then within a month and a half, she's gone. You know, his whole plan, everything just, you know, just blew up on him. And through that whole process, you know, he had all kinds of volunteers come into the house from hospice, from the church, you name it. And he said, you know what, my plans are shot. I'm going to devote my life to volunteer driving, to volunteering. He didn't even know what. Someone told him about a volunteer transportation center, about us. And he started driving. He said, you know what, if I didn't have that, I didn't have a reason to get up in the morning. I had no purpose. I had no sense of community, and it helped him heal, helped him move on. You know, it just changed his whole world, and it allowed him to move on and to have a great, you know, next chapter of his life. And he made a huge difference in all the folks that he supported through that process. So it can have a big impact. So I'm probably way over my time limit. So Patricia, I could talk for hours on this. So thanks for having me.
Thank you very much, Sam. And both you and Mike are certainly inspirational. Hearing those stories of the impact on the volunteers has been really powerful and put some feet on the legs of that policy that we heard about during the first panel. Our final speaker is a man named Arthur Albert, or Double A, as he's affectionately known. Arthur is a Missouri-based voiceover actor, model, and mentor who runs a very busy schedule and has been a writer with ITNGateway for the past 2 years. Arthur has appeared on the David Letterman Show, Saturday Night Live, 30 Rock, and after today, the Philanthropic Collaborative. Thank you for sharing your experience with us, Arthur.
Thank you. Can you hear me and see me?
Yes.
Great. It's an honor to be with you all. I was born on Memorial Day, May 30th, 1932, in the Bronx, New York, right in the deepest part of the Depression. At 12, I started working, delivering pharmacy orders. At 16, for the next 3 years, I was with the Irish Mafia, who owned the concession stands at Yankee Stadium, the Polo Grounds, and Ebbets Field. In my adult life, I sold textiles for 25 years in Toronto, Canada, and St. Louis, Missouri. And then all of a sudden, I find myself back where I started from, New York City, Jungle Land. And my inner voice was speaking to me and saying, well, Double A, what's next on your mind? And I answered, I want to become an actor. And at 49, I joined a drama school. I went to a voiceover coach. I created headshots for my new career. And then I jumped into my own rocket ship and shot for the moon. And even though I missed, I still ended up among the stars. And being with Letterman 14 times and Saturday Night Live and Alec Baldwin, boom. My big break came when I was 78 and Ashton Kutcher chose me from 9,000 actors to be on his reality series called Forever Young on TV Land. And then fast forward 40 years later, my devoted wife, Rosalie, and I end up back in St. Louis in an apartment, and we feel isolated. We're alone. We're senior citizens. And thanks to the higher power that we have, ITN Gateway to Peace of Mind came our way. And what they did for us was to send us courteous drivers, touch of class people, to bring us in clean cars on time to and from the hospitals, the banks, the doctor's office, the shopping. And then brought Rosalie and I home safely. So in my short moment of truth and sharing happy feelings, my respect and love go to the Show Me State office of Trey, Martha, Debbie, and to those drivers like Holly, like Tony, like Paul, and Bill Livingston. And that is what I feel honored to be part and to share with one and all truth and happy feelings all across the world. Thank you, Patricia.
Thank you. What a strong and powerful message you gave. Thank you so much.
Thank you.
Double A, you were wonderful. And this panel has been inspirational. With that, I'm going to turn it back over to the amazing Katherine Freund, who is going to facilitate the Q&A.
Thank you, Double A, and Patricia, and Sam, and Mike. So, you know, I think these are great speakers. I think if anyone in this meeting hasn't thought about what mobility means until now, I hope you have some sense of it. It's access to life. And it's valuable for the providers, it's valuable for the volunteers, it's valuable for the people who use the service. But I would add to that, it's valuable for their families who know they're moving safe. It's valuable for the healthcare providers. The patients arrive on time and leave on time. It's valuable for the stores where they go shopping and the hairdressers. It's community. It's very, very, very important. We do have some questions, and I hope John Cochran is still here. There is one on policy in New York.
I am here.
Okay, so this was a question on volunteer protection in New York. Let's see if I can find this again. I may need some help from Susan or Nicholas.
Yeah, let's dig that one up. I think Susan has another question while we search for that one. Susan, you want to take it away?
Okay, yes. The question is, how do we receive volunteers from America's Volunteer Drivers Center?
Okay, well that's I can take that one. We're as I mentioned when I spoke, we're gonna do a technology plan, which is basically a platform on the internet, a website, to be simple about it, where people can go to learn about volunteering, and you know, we'll learn through the work of our advisory council if people want to actually have the volunteers screened through the volunteer center, or they want to screen the volunteers themselves. But the nonprofit transportation providers, whether they're public transit or they're nonprofit providers, will also be able to log into that database, that website, and say what volunteers they need. And at least as I see it, I don't think that America's Volunteer Drivers Center should be controlling the process, but facilitating the process. So whoever wrote this, if you're a transportation provider, I'm just going to pick a location. Let's say you're from Minnesota, and you're in the Buffalo, Minnesota area, and any people who come to the center who want to volunteer, will introduce them to you, and you can work with them and see if it's a match. So it'll be up to the local providers and up to the local volunteers to see if it's a match. And we will do everything we can to facilitate that process, to recruit volunteers and to get them ready to be drivers and to introduce them to the providers. So we're like a conduit. I see it as a conduit and an education center. So the question for John. I don't know if you can see this. I'm going to read it to you if you can't. Our volunteer driver program has increasingly received objections from prospective volunteers about increased premiums on their insurance for being a volunteer. Insurance companies are treating them like Uber or Lyft drivers, and this can be a deterrent. I know that advocates have been successful to protect volunteer driver programs from being treated as Uber and Lyft drivers in other states. Are there any advocacy efforts to protect volunteer drivers in New York? And I'll turn it over to you, John, and then after you answer, there's a few things I'd like to add, if I may.
The quick answer, as far as I know, no. I know, Katherine, at one point you had raised a variety of issues with Greg specifically, and I'll let you opine and educate everybody about what some of those issues were and some of the challenges that you could help us think through and potentially addressing.
Sure, and Lori's here because AARP has done some good work on this too. So we've been working on protection for volunteers, which is a state policy issue, not a federal issue. We've been working on it since probably 10 years before Uber and Lyft were even a gleam in anybody's eye. And there is a law that was passed in Maine in 1995 that prohibits insurance companies from discriminating against people who use their cars to volunteer. They can't be treated as a risky class because they volunteer. So their premium cannot be raised or denied because they use their cars to volunteer. And that policy in Maine has been copied. I think that's how I met Lori Parham originally. We worked on that in Florida. I think it was 2008. It was a long time ago. But John, what this individual is referring to is that when Uber and Lyft came along, if my memory is correct, they changed policy within 3 years in 47 states and the District of Columbia. And they had certain language that they used, and it was adopted in many places. And the insurance companies began sweeping the volunteer drivers in with the Uber and Lyft drivers and treating them as for-profit drivers. There's a very big difference between a for-profit driver and a volunteer driver. Lori even talked about the reimbursement levels. They're very, very different. Jan Alynett from AARP's Public Policy Institute has done a beautiful paper on volunteerism and insurance, and I will get that to you, John. And then I do think that one of the issues that the National America's Volunteer Driver Center should address in our environmental scan are policy issues at the state level, because this remains a very big issue where insurance companies are discriminating against volunteer drivers. Lori's put.
I have a question, Katherine.
Sure.
What ways can we incentivize healthcare providers to provide transportation to patients?
How can we incentivize? Well, we can ask them. We can point out to them that when patients arrive on time for their appointments, that they save a tremendous amount of money. That is, they don't lose money. So there's an economic incentive, definitely. And the cost of supporting volunteer transportation is far, far, far less than the cost of supporting transportation through a provider that needs to make a profit on the ride. Also, the behavior of volunteer drivers tends to be very different than the behavior of for-profit ride share drivers. Not that they're not wonderful people. It's just that they're independent contractors and they may not be required to provide assistance to anybody. They could if they want to, but they don't have to fold walkers. They don't have to lend an arm on an icy sidewalk. They don't have to open a door. They don't have to escort someone in to sit down. And many people need that kind of assistance. You know, if they didn't need that kind of assistance, they'd be driving, right? Or they'd be taking mass transportation. So there's a lot of economic incentives for healthcare providers. We work very closely with one company, Regeneron Pharmaceuticals. They have funded over 100,000 free or discounted rides for eye health care in the United States over the last 10 years. So we can also work with healthcare providers to help manage those kinds of incentives. And I hope that is enough of an answer.
Okay.
You have another one for me?
Yeah, we have one last question, and then we will answer other questions privately because we're not going to be able to get to all of them. But the last question we have was, we are having trouble recruiting volunteers. Do you have any insights or suggestions?
Yeah, I think there's more to it than people think, or we wouldn't have this problem. If it were easy to do, we wouldn't have this problem. So I think we really need the help of a really good marketing company who's going to help us understand what are the messages we need to get out to people that are going to open their eyes or inspire them or motivate them. What populations do we need to reach? What are the channels we need to reach them? What are the specific actions we want them to take? So, who do we reach? How do we reach them? And then what do they do when we reach them? So there's going to be a lot of interaction between having a place where people can go. I do think that's important. And getting those messages out there. And I think that the work ahead of us through America's Volunteer Driver Center and this national campaign, if you think about it, right now, it's like every community, think of them as like little and think of the rock that they're pushing up the hill as very, very big, right? And they're doing it alone. But with a $20 million national public information campaign, something like buckle up your seatbelt or go get your booster shot or, friends don't let friends drive drunk, or this is the egg and this is your brain and this is drugs, if you remember that one. We need a national campaign to get people to think about this. These messages work. And I think that when we finish this plan and we raise the funds for the national campaign, that Americans will think about aging differently, and they will think about the importance of mobility differently, and they will be inspired to lend a hand and help address it. So at least that's the way we're looking at it. And I think they're giving me the hook here. If you can't see it, there's a hook on my neck where I have to close. So I just really want to thank everybody for joining us. This really has been a wonderful, wonderful event. I'm grateful to all of our speakers and panelists, to Stacey, Lindsay, Lori, Steve, who else is here? John, Double A, and Sam and Mike, and our chair, Dave Melton. Thank you for joining us. There's going to be, when you sign off, there's going to be a little pop-up that's an evaluation. I think it's 3 questions. It should take you less than 1 minute to answer them. If you wouldn't mind taking that minute and help us so that we know how to do this better in the future. We will be in touch with you all by email to keep you updated on our efforts and our progress. And I just thank you very much from the heart for being with us today. Thanks, everybody.